Welcome everybody. Good afternoon. Hopefully you had a good lunch. This is going to be Equity in Healthcare, providing patients with the digital skills necessary to access healthcare. I think I've got that right. Yep. I've got the pleasure of introducing you to Teresa Slottick. She is the National Partnerships and North Star New Business Specialist at Literacy Minnesota and works with organizations to ascertain and implement their digital literacy needs. Teresa also works with the Literacy Minnesota's National Open Door Collective program on poverty reduction through literacy. Prior to this, she developed statewide training on navigation related to adult persistence. And Teresa worked as a counselor, project manager, and corporate trainer before joining the field of education. Fun fact about Teresa is that even though she grew up in Minnesota, she was actually born here in Madison while her dad was doing a postdoc here at the university. So take it away, Teresa.
Okay. Is it on? No. How about now? How about it's not working? Okay. So I did live in Madison from the ages 0 to 1, and then I moved to Minnesota. But that has led my boss to claim that I should be a Green Bay Packer fan because I have this, connection to Wisconsin. I am not, so I'm sorry, but so today we're going to talk about equity in healthcare and around digital skills, which we've been talking about a lot at this conference. So some of the first pieces of what I am going to present probably will go through sort of quickly because a lot of speakers have touched on it. I'm going to give you just a little overview of what Literacy Minnesota does, and then talk about the need for digital equity in healthcare. And then we'll go over what North Star has. So North Star is a platform we'll be talking about that has a free version and a subscription version, very low cost. And we'll talk about the assessments, the instructor-led curricula, the self-directed online learning, and then the reports that are associated with all of that. So Literacy Minnesota has been around for about 50 years. We are a nonprofit, and we work with adult literacy. And we ourselves have 5 schools in the Twin Cities of Minneapolis and St. Paul. And 4 of those work with people who are learning numeracy, writing, reading, ESL, citizenship, and then of course digital literacy. And then our 5th school is solely focused on digital literacy. We also provide statewide training in Minnesota to educators and volunteers who are working with adults on literacy. And because of that, we have a lot of resources on our website. So if you are an adult educator and you don't know about our website, so if you look up Literacy Minnesota, but .com, .org, I think, tons of educator resources, 98% of them are free. So everything from how to work on pronunciation with pre-beginning English language learners to how to look at reading comprehension and all kinds of toolkits. So please take advantage of that. And then nationally, those educator resources are accessed actually from people around the world. But we also do advocacy, like was mentioned, around reducing poverty through literacy and bringing in healthcare, libraries, adult education to work on changing policies and research and funding to go toward literacy for adults. But we're going to talk about digital literacy today, which we also are kind of national and international providers. So we've been talking about digital equity throughout this whole conference. Why is digital equity important? What can I not do if I don't know how to use a computer or use a smartphone? What are things outside of healthcare? There is healthcare, but what else can I not do? You can just shout it out. You can't apply for jobs. Most jobs you apply for online. Anything else that you can think of? What can I not do if I don't have digital skills? I can't shop on Amazon. And during the pandemic, that was like helpful for a lot of people, right? Right? Yeah, there's so many government programs you can't that you sign up for online, and so you need help if you don't know how to, if you don't have those digital skills. Any other? Online banking, right? I mean, think about all of the extra time you have to have if you have to go to your bank and you can't do it online. Yeah, online registration for you, and also helping your kids with their education. A lot of that, you get emails from teachers, or there are parent portals. So, yeah. Mm-hmm. It's so true. Or else you call and you get put on hold and no one ever answers. Yeah, so true. So digital literacy and having those skills are really important for pretty much being in this society right now in the United States. They're really important, and they really touch a lot of points. And even just think about in politics, being able to look up information to see, to verify if what you're hearing is what others are saying as well. So we know digital equity is important. We know digital literacy is important. And we've talked again about what are the components of digital equity. And I like to think of them and talk about them as kind of a three-legged stool. So can anyone guess what the three legs of the digital equity stool? What do you need to achieve digital equity? What does someone need, a person need? Internet, yep. Access, right? A device. Anyone guess the third one? Literacy, the skills, the digital skills. So we have our devices, our access, and our skills. So we've seen a lot of money come through during the COVID time for devices and internet access. Not everyone yet has broadband or devices, but oftentimes what was left out of that picture were the digital skills needed to use those. So if I'm given a device, if I'm given a Wi-Fi hotspot, but I don't know how to use it, it's going to sit on my shelf collecting dust, right? So we need to have all three legs of the stool for it to stand. So here are some stats for those of you who like stats. But you can see that there are quite a few adult Americans who don't have what we would call basic digital literacy skills. We're not looking at just a small population. It's quite a few people. And then as we move into looking at specifically the healthcare field, there's even more that don't feel, especially at this age range, that don't feel comfortable using digital technologies for telehealth, for example, or who don't have the skills. So this is something that we want to change. And digital equity really is equity. So when we look at a lot of the studies, we see that many times, disproportionately, like in these examples, Black and Latino workers make up a greater percentage of people who don't have digital skills compared to their percent in the workforce. So this is an equity issue, and you think about all those things we talked about that you can't do if you don't have the digital skills. It's really putting people, across the gap, the digital divide. So what we did so I'll tell you more about North Star, but we look at basic digital literacy and how to assess that and how to then provide education around that. And I was talking probably a year and a half ago at a town hall meeting we had, virtual town hall meeting we had. And at that meeting there was a patient care advocate from the University of Wisconsin and Madison, and a nurse from Wisconsin. And they later contacted me and said, we are seeing that a lot of our patients don't have the digital skills necessary to take advantage of some of the healthcare technology that's out there. So could we find a way to work with you and maybe create some of these training programs and assessments and find funding? And since we're a nonprofit, we would look for funding to improve our product. So in talking to them, and then I went out and talked to insurers, and I talked to providers, and I talked to federally qualified, health centers, anyone I could find and who would be willing to talk to me, I talked to. And in all those conversations, these 5 areas kind of came bubbling up as areas where patients really need help with their digital skills. So telehealth would be how to perform the tasks to access telehealth, right? The digital tasks. Patient portals is how to get on a patient portal, how to contact your doctor through a patient portal, how to get your test results, those kinds of things. Wireless medical devices would be let's say you have a blood sugar monitor that you wear, and that information you upload then to your doctor. It can be really helpful, but not if you don't know how to upload the information. Credible medical information, you all know how important that is. And one of the organizations that we talked to, of course, was Wisconsin Health Literacy. And probably about a year ago, so I've known Michelle for a while, and we connected, and we said they were seeing the same things as they were talking about teaching people credible medical information. Some people didn't have the digital skills to actually get on the internet to look for this information. So they were kind of encountering that problem. And so again, they really were great partners in helping us think through some of these things and kind of brainstorm about potential funding opportunities. And then health insurance, how to apply for health insurance, how to discern which health insurance online is best for you. So those are kind of the 5 areas that we at North Star Literacy Minnesota decided that we wanted to focus on to be able to help learners across the country develop these skills. And so then we decided to go seek funding to make this possible. So North Star, just a little background. North Star has been around for about 10 years. It's used in all 50 states and several different countries. And one thing, though, I want you to know is that currently it's only available in English. And we've talked a lot about making this available to other populations. And of course, North Star would like this to be, we want this to be translated into other languages. And to do that, it takes some underlying coding, which for a nonprofit is somewhat expensive. So we've been working with our partners in the city of Miami, city of Philadelphia, state of Hawaii, state of Washington, state of Oregon, who've all kind of crowdsource funded this project. And we've raised about 2/3 of the money. So we've started the coding, and we hope to kind of it to be a slow rollout as we do this. But we hope to have the first couple of assessments, which I'll show you, available in Spanish by the end of the summer. And then as we complete the coding, it's much easier and cheaper to translate it into multiple languages. So that's kind of our trajectory. And North Star is also fully compatible with laptops and desktops and Chromebooks. It's mostly compatible with mobile devices, but we did receive a grant from IES to make it fully mobile compatible, because that's what a lot of people have, right? They have their cell phones or they have tablets. So that is also going to be rolled out over the course of the next probably 1.5 years for all of North Star. You can still use it with those devices. There's just a few drag and drop questions that don't work on mobile devices. So North Star started at the request of our local library in St. Paul during the last great last Great Recession. And that library was seeing a lot of displaced workers coming in, wanting to up their digital skills so they looked good to potential employers. And the library had classes, they had computers, they had staff. But what they were finding was that in any given class, the range of digital skills was so great that they weren't really effectively helping anybody. So they came to us. We have experts on staff, and we're connected with experts nationwide. And they wanted us to develop some basic digital literacy assessments so they could kind of figure out what people knew and how to place them. And this sounded great to us. And so we got those experts together, and they started doing focus groups, and they looked at the literature, and they came up with some topic areas that they felt were essential for basic digital literacy, like using email or searching on the internet or basic Word. And once they developed those topics, they started creating standards for them. So standards are really the skills you need to be competent in this area, right? And once you have the standards, and I'll show you the standards we developed for telehealth in a minute. Once we had the standards, then we could develop the assessments. So the standards say these are the skills you need, and the assessments then test for those skills. But they're not like multiple choice test or true-false tests. It's really situational, or scenario-based, I should say. And the person actually has to perform the skills in the assessment. Because we work with adults on literacy, we wanted to make this as accessible to the population that we serve as we could, and still maintain the digital literacy integrity that we're trying to teach. So all of North Star is written at kind of a grade 4 English reading level, which would be about an intermediate English language level. And then we decided to make it web-based. So as long as you have a device and an internet, you can access it from anywhere in the world. We initially it was free, and there is still a free version. But quickly, we thought initially it'd be just used by St. Paul Public Libraries, and quickly it gained this national attention. And when we saw the need, we decided this was something we needed to maintain, because digital landscape is always changing, right? So we decided that we would hire staff to maintain North Star, and to do that then we needed to go to also a subscription model where organizations like libraries, adult education, community colleges, businesses would pay very low cost for an annual subscription, and then provide that to all the people they serve. So I talked about how North Star started with the assessments. And the nice thing about North Star is it's very flexible. So it can be used in a lot of different situations by a lot of types of organizations. And some of those organizations came to us and said, this is great. Now I know what digital literacy skills my learners have and what they don't, but I don't have staff time or staff knowledge to create curriculum. Can you, North Star, do that for us? And Literacy Minnesota has a long history of creating curriculum for adults. So we just developed some instructor-led curriculum, kind of what you would more traditionally see as classroom or tutor curriculum. But some organizations are like small libraries with 2 computers and part-time staff. They couldn't offer classes. So they came to us and they said, could you offer something that's more, learner-directed, so they can do this on their own? And again, we thought that was a great idea. So in 2020, we started developing the self-directed online learning. And along with that came a learner management system, so learners can track their own progress and report, so that the staff working with them can also see what's going on and at their whole organization level as well as the individual level. So here are the 14 assessments. And I've highlighted in red those that I felt might be important to kind of these healthcare literacy skills. But you could use whatever you want. The telehealth assessment is going to be, it's done actually right now. And Wisconsin Health Literacy was a huge partner in helping us develop this, and we'll talk about how we developed it. But it's done. It's now in piloting stage, and it will be released in April. So all the assessments are free. Anyone can take them and see their scores. The scores aren't saved unless you have the subscription, but you can. Many organizations just use the free version to assess where their people are at. Telehealth, we were lucky to get a grant from the National Network of Libraries of Medicine. And did I say that right? And so they are funding the assessment. And then we have a grant application into them right now, also with Wisconsin Health Literacy, around developing the patient portal assessment. And we should hear about that in the next month. So when you give an assessment, you can decide if you want to, what we call proctor it or not. So proctoring would mean that you're watching the person take the assessment, so that someone else isn't helping them or they're not using notes. But regardless of, I'm going to back up. Regardless of whether you proctor or not, you would always you'll always get the results page. And we'll talk a little bit more about, not too much about proctoring, but a little bit more. But I first want to show you what the telehealth standards are. So other than maybe some folks here who worked with us, nobody else has seen these standards. So you're the first, and hopefully you'll be able to read them. So what we did, what we do always when we create standards, is we have our curriculum writing team work with experts in that area. And so in this case, it was Wisconsin Health Literacy. We had a consultant who works just on telehealth in the healthcare field. And then we had a researcher at the University of San Francisco who works with adult literacy around healthcare. And we also get input from, since I said we have 5 of our own schools, we pay our learners to kind of provide us information too on what they see as necessary, what they have trouble with, or what they see as maybe necessary skills in this area. So trying to get a lot of different viewpoints. So, you start creating the standards, you go through a very iterative process of refining and defining. So these are the standards, and like I said, they're probably kind of small, but I'll read a few of them out to you. So there are things like, it was hard to separate out the healthcare portal part from the actual doing the telehealth visit. And so we have tried to just stick with the telehealth visit. But you can see it's things like how to create a secure password, and how to use mute video and chat, and how to troubleshoot if you're having problems with your video conferencing tool. So I'll give you a few minutes just to kind of look at that while I take a drink. So these are very definable skills that then the assessment can test whether or not someone has these skills. And as I said, so we created the standards, kind of through this iterative process, agreed on these standards, and then started developing the assessments. And this would be true of any of the topics that we've done. But for telehealth, here's an example of one of the questions. So as I said, it's still in the piloting phase, so this is maybe changed a little, but mostly. You can see that it's scenario-based. The person is asked in the assessment to actually perform a skill to see if they can do it. And you can't see it on this slide, but on the next slide, you can say they have the option to click I don't know. So if they don't know how to do something, that's fine. That's valuable actually information for the instructor. And you can also see, you can't see, but this is, the words are up there, but it's also audio. So there's audio that reads those words. You can replay the audio as many times as you want. You can speed it up, you can slow it down. There's closed captioning if you want the words to show up as they're being spoken. So trying to address a lot of learning styles. You can also go back and change your answer at any point, and there's no time limit. So trying again to help those who may have limited digital skills or limited English reading skills not feel rushed. Oh, and I should say, if you have any questions, please interrupt me. I give this speech multiple times a day, so I don't need to hear myself give it. So if you have any questions, just raise your hand and we'll much more fun for me to hear your questions. So here's just another example of one of the questions that would be in the assessment. All right, so here's that results page that I was telling you about. And for any of the topics, North Star says you have to get 85% or higher to pass. Now you can see in this, let's see if I can do this, maybe. In this green column, these are those standards that this person has passed. And in the gray column, these are the standards that they missed. Now if it's a North Star subscription, and let's say they want to practice those skills right away that they missed. Or if you're like me, you're bummed that you passed, but you didn't get 100%. So you can see that it gives you the standard that was missed. In this case, this is an Internet Basics Assessment and Standard 5. And they can go right here to the barbell where it says practice, click on that, and we'll go directly to that self-directed online learning. So they passed the assessment. They don't need to do the entire module, right? It really focuses on those skills that they still have to learn. So this saves people time and saves them kind of energy because they can really focus individually where they need to be. If an assessment is proctored and someone passes, they then can receive a certificate that you all or staff would print out for them. And so this is one of our students who actually passed all the assessments and he's holding several of the certificates. And I cannot tell you how much these certificates mean to people, especially people who have lower digital literacy skills. They're often afraid of breaking a computer or doing something wrong. And this is an objective way for them to see that they know what they're doing. So I've had learners cry when they get them. I've had them give me high fives. People will buy frames and put them all up in their apartments. Like, it's just really meaningful for people. And you can just give one certificate that lists, all the assessments. Most of the time people want a separate one because it's that feeling of pride that they can do this. And we've seen this, since I work with organizations all over the country, I have heard many times how this helps people persist in their other educational or occupational goals, because they can see they put the time and the energy into learning something and they see results. And it's quick results, right? It's not like learning English, for example. North Star is a pretty quick win. So this can be really helpful in all aspects, not just healthcare, but in many different arenas as well. So any questions about the assessments before we kind of talk about the curriculum? Yes.
Normally, when putting together things for English-speaking people, I would go at a 7th grade reading level because that's standard for English-speaking people. But is the 4th grade level because you have people who are not English as their primary language?
Right.
Okay, that was my question.
Yeah, that's a great question.
It was more of an assumption, but I wanted to make sure I was on the right track. Thank you.
Good question. Any other questions? All right, we'll go on. So I now want to talk to you about the instructor-led curriculum. So this would be, again, if you are either working with someone one-on-one tutoring, if you're teaching a class. You can use this in person and remotely, since many of us are working remotely or were working remotely. Our Literacy of Minnesota and North Star, our intention is that we will have curriculum for every single topic that we have an assessment for. We currently have 13 of the 14 completed. The team is working on your digital footprint right now, and I believe that will be done in June. And then we did get some funding from Western New York Library Council to create an instructor-led curriculum around telehealth. So that will also, I think will be done, I think that will be done at the end of August. So that will be coming. So the instructor-led curricula is aligned, as is everything, with the North Star standards. And it's very easy to use. So it's not intended, you don't have to have a teaching degree or a teaching license to teach North Star. At Literacy in Minnesota, we use a lot of volunteers. And in fact, in our computer, the school that has the digital literacy, there's one staff person, then all the rest of the instructors are volunteers. So it's meant to, it's laid out in such a way that it's really easy to use. I was able to teach a class on internet basics before the pandemic. And I'm not teaching for my job. And it probably took me 15, 20 minutes prep time, and that was mostly like printing out materials to get ready. So it really, and I'll show you, but it really tells you what to do and what to say. It's also made for adults, not for children, very learner-centered. The learners that I worked with almost universally told me that it was internet basics. They told me, this is something I've always wanted to learn, and I've always been too embarrassed to ask someone to show me. So it seemed to be something that they were interested in and they were engaged with. There's also at North Star, we believe that you can't learn digital literacy through lecture. You actually have to get in there and practice it. So there's tons of repetition in there. And actually, when I taught it, I first thought, people are going to get bored with all this repetition. But they really loved feeling competent and knowing what they were doing. And one learner said to me about a different class, not the class that I was teaching. She said, we don't learn a lot of material in one class, but what we learn sticks like concrete, was the example she gave. So I think it, really sinks in. The other nice thing about the North Star curriculum is that the lessons are they're independent, so they're very flexible. So if you only need to teach an aspect of a lesson, you can easily do that, or of the topic. So this would be kind of your average curriculum where, there's 8 lesson plans on average per unit topic. So that, like email, for example. The curriculum developers thought it would take about 2 hours to complete one. When I taught the class, it was a smaller class. It was composed of intermediate English language learners. They were in person, and it took us maybe an hour and a half. So it kind of depends on the population that you're working with and their circumstances. You can also use them one-on-one for tutoring, and you can use them for remote teaching. So here's an example of the first page of any lesson would look like this. And so you can see at the top there on the left-hand side, those are the standards that are being taught in this lesson. And we have a document called a scope and sequence that lets you see all the standards in a topic and what lessons you can find them in. So you can easily say, I just need to teach these 3 standards. These are the lessons that I want to pull from. On the right-hand side, those are the digital literacy vocabulary words that will be explicitly taught in this lesson. Many times, I found that in working with people who are learning English, they come from countries or places where their digital literacy skills are great. They don't need digital literacy skills, but they don't know the English terminology. And in order for them to ultimately get back into their fields, they need to learn that. So they're really focused on the vocabulary. And again, around telehealth, that might be the case as well. In the middle of the technology concepts, this is telling you kind of, in instructor language what the objectives of the lesson are and giving you any tips that you need. And then at the bottom, it's basically telling you what you need to prep for this lesson. So here's an example of, so the curriculum developers took kind of the best practices in adult education to develop the curriculum. And they have many different parts, but one of the parts is this model and explain. And so you can see that it tells you as an instructor what to say, the actual words to say, and what to show. So this is important because it maintains consistency across your organization. And also, a lot of times, those of us who feel fairly digitally literate, we know how to do things, but we may not know the actual terms. So if I say to someone, just call something a blue navigation bar at one point and a blue ribbon at another, that's going to be confusing to someone who doesn't know that I'm talking about the same thing, right? So I want to maintain that consistency in vocabulary. And it also helps, if you're familiar with computers, you've used them a lot, you forget what it's like to not know how to turn on a computer or how to search on the internet, right? And so if I said something to someone who didn't know how to search on the internet, well, just click on the link, doesn't mean anything to them. But yet it's something I do multiple times a day. So this gives us the language to be able to best talk about these skills with someone who doesn't yet have them, so that they can absorb this information and make it easier for them to understand. Here's an example of a handout, and you can look at that, but mostly what I want you to notice is the first names in those questions come from a variety of cultures. So in all that North Star does, in the videos and the pictures and the names, we try to incorporate multiple cultures so that the learners who are using North Star feel they can identify with the people in North Star. Any questions about the instructor-led part of the curriculum before we go to the self-directed online learning? Yes?
Have you ever had any of your students volunteer to be an instructor?
Have you ever had a student then become the instructor to see if they're able to like relay their information or demonstrate their information?
Yeah, that's such a great question. And I have, again, I'm working with organizations around the country, and several have told me, and in fact, I've heard from the actual learner that one case kind of stands out one example stands out in my mind, where she came in not knowing anything about computers. I think she knew how to turn it on, but that was about it. She then ended up passing all the assessments, went on to kind of help the instructor, went on to actually teach the class, and then went to community college to do further work in IT. And it was like such a great story, but I hear that in variations many times of how the learners themselves then go on to help their fellow learners or their communities. A lot of times I'm working with digital navigators who are from a certain community, who are then going into their community to teach digital skills because they have those relationships and those connections. And so, and to be honest, there's many just instructors and people in libraries or in adult education who don't feel that comfortable with their own digital skills or teaching it because they've never taught it. So sometimes they will go through oftentimes they will go through the assessments themselves and the kind of the curriculum that they missed, so that they can be sure that they are up to speed. And I'll show you how to take the assessments for the free version. I would encourage you, all of you, to take an assessment, one, to see what it's like and see if it would be appropriate for your population. But also, I have yet to meet anyone who has passed all 14 assessments with 100% the first time, even IT professionals. So just goes to show that, digital literacy is lifelong learning, and we can all, a lot of us have taught ourselves the skills that we have, and maybe we didn't have to know something, or we don't know the most efficient way of doing it. So this is my challenge to you, to take one of the assessments and just see how you do. Yes.
So where might these classes take place? I know libraries sometimes have a bank of computers, or tech colleges. Is there any other place that's a good resource?
Oh, so that is a really good question. So I would say that where often these classes are taking place could be through adult education, so adult basic education or adult foundational education. In libraries, we're seeing a lot of times libraries, especially now because there's been a lot of federal funding coming down to libraries for digital equity. And whole state library systems are buying North Star. So they're in every public library in those states. In community colleges, a lot of times in four-year colleges, they'll do it at orientation to make sure people have the digital skills to be successful in their programs. And if not, then they'll provide those skills. In workforce centers, some businesses who are especially people who are hiring more entry-level workers are now saying that, there's not enough workers out there at this moment, so they're having to train people up. And so they're a lot of times using this to train people on their digital skills. I'm seeing it more now in research projects around healthcare. And so the Digital Equities Act was just passed. And in May, every governor has to choose an entity in their state that's going to be planning for digital equity in their state. So they're getting $1 million each in planning money. And then once those plans are made for the digital equity, and so this would include broadband, devices, and skills, hopefully, they'll be getting billions of dollars, each state, billions of dollars. So I would say to you, get in front of your legislators and say, our sector or whatever it is, how can we help make sure that the people we serve are benefiting from this? So that's, like I said, they're choosing the entities in May. Most likely they'll be broadband coalitions or workforce, probably, but they'll be making the plans for your entire state. And along with that, part of that part of what states have to provide are assessments in digital literacy. So as you're thinking about, that, think about how you might be assessing people on digital literacy if that's the kind of training you're providing. But to your question, on North Star, on the homepage, which I'll show you at the end, we have a map. So if you put in your zip code, let's say you want to refer patients to someplace. If you put in their zip code, it will show you all the organizations in their area that provide North Star and exactly what they provide. If they provide in-person classes, if they provide remote classes, if they only do the self-directed online learning. So that, and it's all free again to any individual. So whether it's a library or a adult education program or what it may be. So that's a really nice resource if you yourselves are not providing the instruction. Yes.
So for the telehealth, so there are a lot of different telehealth platforms out there, as well as different healthcare organizations sometimes have different concepts of what actually is telehealth. How does the telehealth assessment account for all of those differences?
Yeah, that was a really a tricky thing to get around. And so what we decided to do was look at some of the major telehealth portals, or if you will, or ways of accessing telehealth, and kind of make a generic model. And in digital literacy, there's this idea called digital resiliency, which means that you can't possibly teach everyone everything about everything, everything about all digital literacy, but you can teach them skills that transcend various platforms, because something new is always going to come along. And the idea that if they know that this exists in one arena, that most likely it exists in a similar platform, and that they can figure out then how to do those things. So that's a really, it was impossible to do an example of everything. So that's kind of how we handled that. Yeah, good question. Any other questions? All right. So I am going to now show you what the self-directed online learning looks like. So this could also be, if you're not some organization that's going to provide instruction, you, if let's say you have North Star, you have unlimited, there's no seat limit, right? So you can serve however many people you serve. And as the subscription's an annual subscription, as long as you have it, those people can come back and do whatever online learning they want to do. We don't yet have telehealth. We're looking, for funding for that. But these are the 6 that we do, and the first 3, again, may be important for in healthcare literacy. We're now working on Excel, which may or may not be of interest to you, but that will be done by the end of May. And then the team has started on social media. We are hiring someone right now to kind of speed up this process. So we started in 2020, takes a while, so we're kind of trying to make sure we get all 14 and then telehealth done as quickly as we can. So I want to show you an example of, it's easier for you to see this than for me to explain it. So I'm going to go to the self-directed online learning. What you're going to see on your screen is a laptop. Actually, we're used to doing this virtually. What you'll see on my screen, hopefully, is a laptop. And I'm going to play the sound for you.
If you look closely at the outside of a computer, you will see buttons and many small holes. These holes are usually called ports. Each port has a specific shape for different uses and different types of plugs.
Sorry, I didn't realize you were seeing that. So you can hear that she reads very slowly and clearly. And you can replay the audio as many times as you want. You can speed it up, you can slow it down, you can turn it off. So hoping to meet a lot of different learning styles. So the way North Star online learning is set up, and these are, sometimes people refer to these as the practice lessons, the online practice lessons, is you'll have this instructional piece, but like I told you, we at North Star feel like you can't really just learn through a lecture, you actually have to practice the skill. So I'm going to click on the next button and you will see an example of that practice.
Here is a flash drive that you can plug into a computer. Click on the port that matches it.
So then if I click here, it says, yep, that's a USB port, right answer. If I had clicked on the headphone jack, it would say, no, this is a headphone jack. Look for something that matches, you know, the shape that's shown up there. So the way the self-directed online learning works is you'll have this instructional piece, practice piece, instructional piece, practice piece for several of the standards. And then there'll be a little quiz. And the quiz will say, you're ready to go on in the module or go back and review this section. At the very end, there'll be, you know, maybe 3 or 4 of those sections. And then at the end of the module, there'll be another quiz that says, you are ready to retake the assessment or go back and review X, Y, and Z. So again, very tailored to each individual learner and what their needs are. And because of that, then we also have a learner management system that lets the learners see what they're doing and what their progress they've made. So if we go to the learner dashboard, this is what a learner would see. It looks like I have to log in. Let's see. Sorry about that. All right, so this is what the learners would see. And you can see that all the assessments are here. So once telehealth is added, it will be here. You can decide what you want your learners to see. So if you only wanted them to see telehealth, you could limit that, or if you only wanted them to see certain assessments. You can see here, if we look at the top row, they all have the Take Assessment button there. So this would bring the person to the assessment. Oftentimes how many organizations use the assessment, they'll give a pre-assessment, see what someone already knows, where their learning opportunity is, then provide that instruction either, you know, through the self-directed online learning or the classes or a combo, and then have them take the assessment again to see if they passed and can earn that certificate. You can see here for these 3, next to Take an Assessment, it says lessons. So I told you that we currently only have 6 of the self-directed online learning modules completed. If it has the word lessons, that means it's completed. And then if you look at like Mac OS, you can see it says details, and then there's some bolding that said the lessons are not yet developed. So trying to make that clear to the learners what they have access to. Each module takes about 90 minutes to do in total, but a person can stop and start. They can do 10 minutes a day and then 10 minutes the next week, or whatever it fits into their schedule. So if they go into the lessons, and they go to this standards tab, they can see which of the standards they've missed, and then you can see over here what, if they've done the practice lessons or not. It's right here. And you can always review something as many times as you'd like. And you can also say, okay, let's say you're learning about the internet. Let's say you've passed this maybe 6 months ago, and you're going to apply for a job, and it's an online form. You might want to come back here and just review, fill out an online form. So, you know, you've maybe forgotten how to do it, or you want to refresh your memory. You can always come back and also look at anything specifically that you want to do, or do the whole module again. Any questions about that piece of it? So then you, as staff, also have access to individual learners' reports, which will show up here in a second. So then here you can see under the word module, these are the assessments, and if you hover over them, it will tell you what the assessment is. Under best score, that tells you how many times they've tried to take the assessment, what their scores are. It's color-coded, so you can't really tell so well on the screen, but it's green if they passed, and then yellow, I don't know if you can see that, if they haven't. Then the practice lessons talk about, you know, how much of the self-directed online learning they've done. And if you go to the I, that's next to, under history there's more information. So this shows you as an instructor or someone who's looking at, what they know. Let's say there's something a standard in telehealth that you absolutely need them to know. You can see here if they've passed that standard or not, and if they've done the practice. If you continue to scroll down, you can see, when they took the assessment, how long ago that was. But if you click on the eye and go to the very bottom, it will tell you the questions they actually missed. So if this person's having a difficulty with this assessment, you can click on the number and it will bring up the question. So you as an instructor kind of have some inside information as to what might be difficult. Maybe it's the language, maybe it's asking for multiple answers and they're only giving one. I would never tell you to teach to the test, but it just gives you more information. I'm gonna kind of just skip that for a second. The other reports that you have access to are more organization-wide. So, this one would show you how many assessments are being taken, and if you hovered over it, it would give you that number, right? So then you could see how many telehealth assessments are we giving, prove to those who are funding this that you're using it. Or here you can also see if you're providing other options, you can see what people might be interested in. So if you are in the business of providing classes, you might say, well, a lot of people are taking Windows, not that many Mac OS. So maybe we have a class in Windows, but Mac OS is something maybe some people work on more on their own or with a tutor. And then if you look at the assessments passed, this is the percentage of passed. So you can again see how many people are passing, let's say in this case, telehealth. On here, you see a lot of people are passing email. That seems to be easy for this group, 68%. Maybe not so many people are passing the basic computer skills, 41%. So maybe you would again say for this population, email seems pretty easy for them to learn, so we'll have them do it on their own with the self-directed online learning. Maybe basic computer skills are more difficult because it's a population that doesn't have many skills, so maybe that's something where we'd work with a digital navigator or with a tutor or whatever it might be, provide a class. And then up here on the detailed reports, gives you that same information, but it will take a second to load. Just also what questions they're having problems with. So if you're seeing like this population that you serve, let's say it's on telehealth, they're having a lot of problems with how to troubleshoot. Well, then maybe that's something that you bring in your digital navigators to help you with, or that you touch with them before they're going to do the appointment to know that that's something that people struggle with. So there's other reports, but those are some of the reports in North Star. Any questions before we just talk about this? Any questions that you have in general? This is looking at the free versus the subscription, what's in each. Subscription for a library or a school, like a single entity school, is $500 a year, and you can serve as many learners as you have. So but then there's also the free, which I'll show you how to access here.
How about promotional materials? Do you have materials available?
Mm-hmm. So if you have a subscription, we have flyers, we have, if you're in a library, rack cards, we have posters that would have some pictures of our students actually, and some wording, and then a place for you to write in your own information of what you're offering. Yeah, good question. Yes, way in the back.
So I'm actually in the Twin Cities with Health Partners.
Oh, great.
Have you connected? I just am curious. This is a selfish question, but
Yes.
Have you connected with the Minnesota Health Literacy Partnership, which is part of Literacy Minnesota? Just because, and I could see why maybe that didn't happen because it's all, Alina and Health Partners and health systems, and I'm wondering if there's opportunities to leverage this training with some of the barriers we're seeing with our members and our patients.
Yeah, so I have actually gone to that meeting at Literacy Minnesota with that group a while ago, pre-pandemic actually, I think, and have talked to them, sent some information, but I would love to connect with you and do that because I think that'd be a perfect fit. So, yeah, come up and see me afterward. Yes. She's coming.
Maybe you touched on this in your explanation, I missed it, but for the learner dashboard, if I'm the learner, are you collecting data on how often I might be going back in and retaking? And then is that a focus area maybe for, I don't know, enhancements, or like you said, is that where the digital navigator piece is maybe coming in, or?
So that's a good question. So it does capture how many times someone has taken an assessment. And it could be a really good point. You know, digital navigators can help it in a variety of ways and in a variety of places. But that might be a clue, like if someone takes it more than twice and they're not passing, maybe that's where they would need some more individualized help. So that would be a really great way to kind of to see what learners need more attention. I think it's a good idea. All right, so I do want to show you how you can access the free information. And like, you know, try it out for sure. And we are more than happy at Literacy Minnesota if you only use the free information, because our goal really is to, you know, close the digital divide as much as we can. So for any of your constituents or yourself. This is kind of what we have on the free website that might pertain to, let's say, healthcare, at least in my mind. But we have all the assessments. We do have the basic computer and the email self-directed online learning for free. The assessments are all the same. The only difference is, again, there's no record kept. So unless someone took a screenshot or wrote it down, we would have no record of those assessments. And then the self-directed online learning, again, the same content. The only difference is that in the free version, you have to do all 90 minutes or the whole thing at once. Otherwise, you have to start from the beginning. So you can't stop and, you know, obviously you can't stop and start because you're not tied to the learner management system. And then we do also have links to external free resources that we did not create, but that we feel align with our standards. So many organizations just look at our standards actually and say, you know, these are the skills that people need to have. How do we make sure they have them? And they do it in their own way. So here's our website, the digitalliteracyassessment.org. If you put in North Star Digital Literacy, you would also, you know, it would pull it up. And if you go to the site, oops, I'm trying to get my cursor here. All right. If you go to the site, you can see here in green, in the green oval, it tells you that you can take an assessment. If you click on that, then it will bring you down, and I'm logged in, so you'll see some things that you wouldn't see if you weren't logged in, like this, and the warning you wouldn't see. But you would come down here and see all the assessments that are available. You just click on one, and it would do a little sound check for you, give you an orientation if you want it, and then you'd start the assessment. So again, if you do the free version, only those results aren't captured or anything, but it's helpful just to see what the experience is like, and to see if you can, you know, get the 100%, or the 80% is 85% is passing. To find those free resources, if you go to features up here in the black navigation bar, under the woman's face, it lists all the standards. So the telehealth standards will be up there at the end of the month. And then if you go to the North Star Online Learning, so this, first there's assessments, then there's North Star Online Learning, where it says NSOL is the acronym. And click on it, it tells you what it is, but then it should, they changed the website on me, so I want to make sure that it's here. Here, where it says try an NSOL practice module, you see the little yellow icon with the flag. That's where you can access those. And then also, you know, it talks about the assessments and the curriculum. Here's where you can find the North Star location. So if you have a patient who's wanting to learn more about digital literacy, you type in their zip code, and it would bring up a map with organizations near them. This is kind of showing a bunch of different organizations, but you can type in the zip code. Yes.
you. The ones that are free, the emails, the basic ones,
Yeah.
will you also get certification after that's completed and you pass that with the 85%?
So you only get the certification if you, through the subscription model. But your organization could definitely give out certificate, you know, it wouldn't be North Star, but it could be your organization. And I think that would be just as meaningful to the person.
Okay. And one more question. So when you do the other one that's not free, is that instant that you get your certification after you're past that course, or is there a time lapse?
That's a great question. So you get your results instantaneously, and then the organization would give you the certificate. So if you're right there in person, they could print it out right then. You can also send it as a PDF in an email if someone has the skills to, you know, use email and open the PDF. So as long as a staff person is there to give it, yeah, right away. Good question. Any other questions?
Okay, so for your subscription, like is there amount, I'm just trying, maybe you already explained this and I'm just not getting it. But, so if a library does get it, but someone tries to access it at home, like how would they get that like subscription? Or is there like a certain amount of access codes you give out?
Oh, that's a good question. So so many libraries do have North Star, and either people will come to the library and the librarian, you know, someone on staff will sign them up. And to sign up for North Star, you only need someone's first name, last name, and an email address. Now, some people don't have email addresses because they don't know how to use email or they don't know how to use a computer. You can create an email address for them. It can be a fake email address. They don't ever actually have to access their email. That's just their kind of our way of identifying them in the system. That's the only information we collect from someone. But once they're in the learner management system, then they can, from wherever they are, again, as long as they have a device and an internet connection, they can enter that onto our website, that email and password, and then they're into their dashboard. So, so that way, you know, the library can sign up every single patron that comes to the library if they want to, and then people have access to it. Libraries can also, or anyone can also do self-sign up. Again, that's assuming people have the digital skills to do that, and not everyone that we are serving does. But any other questions? I think we're probably over time.
Thank you so much for your presentation. It's a lot of great information for us. If you'd like to practice your digital literacy skills, go out to the app and do an evaluation for the session.